Hello everyone. Today I'm here to talk about hypertension. Whenever we go and take our BP, we are told two numbers, one on the top and one on the bottom. Let me tell you first, what does these two numbers mean? One on the top means the pressure the heart is making when the heart is becoming small and trying to squeeze out the blood from the heart. And the below number is the pressure made by the heart when the heart is becoming big and trying to accept the blood inside the heart. Now, we are always confused what is the number we should follow, that number which indicate we are hypertensive or we are normotensive. For clarity or for easiness, let us take that number as 140 by 90. So, if a person is not having any other ailments, 140 by 90 is the number above which we will call it as increased blood pressure. And for those people who are having other ailments like diabetes, chronic liver disease, or heart problem, we should take it as 130 by 80. Any blood pressure which is more than 130 by 80 should be taken as a high blood pressure. One more thing here I want to clarify is that a lot of my patients come to me and ask me, when I measure my blood pressure at home, it's different. When I measure my blood pressure at doctor's clinic, it's different. So, which blood pressure should I take? The genuine answer from my side should be the blood pressure where you are comfortable. If you are comfortable at home, that should be the blood pressure taken as your blood pressure. And if you are comfortable in the doctor's office, that also can be taken as your blood pressure. The main thing about blood pressure here, what I want to explain to you is that your machine should be correct, whether it is mercury machine or a digital machine. It should not make much difference. If you think that your machine is not correct, you should take your machine to a doctor's clinic where a doctor will take your BP, and again you measure your BP with your machine. Then you compare the machine reading with the reading of the machine from the doctor's clinic. Then you will have an idea about the differences. The important thing during taking your BP is that you can take BP while sitting or you can take BP lying down. If you are taking BP while sitting, your leg should rest on the ground properly and your hands should be resting on a armrest, or your hands should be resting on a table which is comfortably high. And you should be rested for at least 10 minutes. From my point of view, you should at least rest 30 minutes before you take a blood pressure. So thus, if you take blood pressure like this and recheck your blood pressure after 15 days, and again if you like, you recheck it after 1 month, and see all these three readings of blood pressure, and if you see that all these three readings of blood pressures are high, above 140 by 90 for normal people, and for those who have other diseases 130 by 80, above should be taken as high blood pressure. Let me tell you some more numbers. It might be of help to you, or you might have some confusion about the numbers because you hear so many numbers in hypertension. So the simple thing is that if in your BP, if the above number is from 100 to 120 and the below number is from 60 to 80, that is a normal blood pressure. For them, they can check their BP after 6 months to 1 year. For those, if their top number is from 120 to 139 and the below number is from 80 to 89, we can take it as a pre-hypertension. These people are very likely to get hypertension after some years. So for them, you will have to measure your BP every 3 months and at least do lifestyle modifications. What is lifestyle modifications? I will tell you in the part 2 of this video because I do not want to make this video too long. There is stage 1 hypertension, there is stage 2 hypertension. For those whose blood pressure are more than 130 till 159 in the top and from 90 to 99 in the below, it is stage 1 hypertension. For those who are having BP is equal to or more than 160 in the top and is equal to or more than 100 in the below, they are having stage 2 hypertension. There are other stages and other types of hypertension also, which will not be very helpful to you to know. So let us restrict our knowledge to this normal pressure, pre-hypertension, stage 1 hypertension and stage 2 hypertension. In stage 1 and stage 2 hypertension, you should do the lifestyle modification and you should consult a doctor and start medication. What are the causes of hypertension? How can you win hypertension and be cured of hypertension? I will tell you in second video. Please watch it. Thank you.